So in this video we are going to talk about cervical spondylosis. Now cervical spondylosis is degenerative disorders due to age-related wear and tear in the cervical spine. Now it affects all the parts of a cervical spine: intervertebral disc, facet joints, ligaments and lamina. Now if you see the statistics part, 85% of the population over the age of 65 years and 60% of the population over the age of 45 years are affected with the cervical spondylosis. Now what's the problem? So degenerative changes due to the age related will lead to changes in the biomechanical structure of a cervical spine. Now changes in the biomechanical structure of a cervical spine will lead to narrowing of the spinal canal and intervertebral foramen. Now narrowing will lead to compression on the spinal cord, spinal vasculature and the nerve roots or the spinal nerves. Now if you see cervical spondylosis, history taking and physical examination is a huge topic. I'll try to cover it in the next lecture, where time limit of pain, where the pain radiates, what's the aggravating factors and all the specialties. Now if you see the cervical spondylosis, there it has three clinical subsyndromes. First is axial neck pain, second is cervical radiculopathy and third is cervical myelopathy. Now we'll see the axial neck pain. Because of degeneration in the intervertebral disc, the disc loses the water content and by that the disc loses the weight bearing capacity on the cervical spine. So any compression, axial compression on the cervical spine will reproduce the pain. Hyperextension and side flexion will increases the pain. It can be, axial neck pain can be higher in upright position but can be relieved by rest. Now if the upper cervical spine is involved, the axial neck pain will radiate to back of the ear, occiput and sometimes headache. But if in the lower cervical spine, the axial neck pain will lead to radiating pain into upper trapezius and scapular areas. The most common site for degeneration is C6, C7 and the second most level is C5, C6. The second clinical subsyndrome is cervical radiculopathy. Now cervical radiculopathy follows the pain distribution according to the myotomal distribution of the nerve roots involved. Cervical radiculopathy pain can be either unilateral or bilateral neck pain, arm pain, weakness in the arm and hand function and even paresthesias. Radicular pain can be aggravated by the neck movements on the affected side. Now the third clinical syndrome is cervical myelopathy. Myelopathy is where the compression on the spinal cord in the cervical area. The symptoms are insidious in onset. It can be with the neck pain or without the neck pain. Gait instabilities are seen. Gait is unstable, unexplained falls, difficulties in fine motor hand function and loss of balance. In the next coming video, I'll talk more about the history taking and the physical examination in case of cervical spondylosis. Thank you.